Okay, go ahead, go ahead.
This is also being televised. You guys will not be on the camera. So I'm just very thankful for the city of Seattle, ADS, Seattle Public Library. What is your official group title, Seattle Public Library? No, the aging, it's amazing, our partnerships that we've had with Seattle Housing Authority. I see a bunch of Department of Department of Neighbors staff, Seattle Department of Neighborhood staff here. It takes a lot to make these things happen, so I want to send a huge shout of gratitude to everybody. It shows them that they care about West Seattle, they care about community. And so, if you guys don't know, it's open enrollment time, so this is why this aspect of Civic Coffee Hour is gonna be about that. I'll let somebody from ADS, LDEP, talk about that, and I'll let Emily talk about her programs with Seattle Public Library. So thank you guys so much for being here. Don't forget to sign in so we can keep you looped into community events that are happening. There's a bunch of resources at the back of the table for you. And there's food, hot cocoa, hot cider, some horchata. There's a passion fruit drink. I tasted it's delicious with mint. So thank you. And then we have this amazing from Solid Ground out here. And for some of you, you guys participate in the cooking class on Tuesday that we've been working with Solid Ground. So we're very thankful for your support of our shared community here. All right, I'm gonna pass it to Emily to continue. And did you start the Zoom already? All right. So thank you for those who are just joining. I'm Ella, the community builder for Seattle Housing Authority. Currently, we're right now in the most beautiful neighborhood, I think, in Seattle, High Point. We have more heritage trees. We have way over like 240. We have the longest street murals, and we have some amazing community members, and some of them are here present in this space, excited to learn more about Medicare and connect with others. It is also that time of year for voting. So we actually have Demi from SHA, Seattle Housing Authority, helping anybody that might need to register to vote. So please show your power in voting. All right, here you go, Emily.
Can we give it up for Ella really quick? And then she always talks about the amazing community partners that are in the room, but she is an amazing community partner. And we are so excited to be here. So I think a lot of you know me. I'm Emily Below, the older adult program manager here at the Seattle Public Library. And I'm joined today with Aging and Disability Service age-friendly teams. We have Eldad right here in the front. And then we also have Meg somewhere in the back. She's wonderful. And then we know we have at least one intern as well in the room. So thank you all for being here. I really think Ella did a great intro for today. We have a few folks, so I'm gonna actually pass it over to Meg to talk about gold cards for a second before we get into the panel discussion today on Medicare. So here is Meg.
Hi, everyone. I just want to point out these gold cards. They're for people who are 60 years and older. So if that's you, you are immediately eligible. They're in the back table. So be sure you don't leave here without it. They get you discounts into a variety of entertainment venues, restaurants. In fact, we got one local restaurant, Grillbird, just down the street to join, so you can get a discount by using this card. And we also just recently had the Pacific Northwest Ballet join, and you can get 50% off tickets at the ballet by using this gold card. So take one and take two and share it with friends so you can go together to the ballet and other places. We also have, this long list of other locations where you can use this gold card, and you can find it online as well on the back of your card. Okay, I will pass it along to next up. We have next. Yes, welcome.
Hi, I am Priya Singh, and I am here on behalf of Seattle IT to talk to you a little bit today and to hear from you all. How many of you are?
It was connected to my phone too, so I wanted to unconnect. Sorry.
How many of you have heard of a company called Comcast? It's a small company. Everybody heard of it?
So every 10 years, Comcast has to contract with the city of Seattle to re-up their, what they're doing in the city. And revenue that Seattle gets, the money Seattle gets from that, goes to support digital equity programming. So those are things related to how to connect to devices, if you're getting devices, if you need to learn how to use devices, or like apply for a job. Some of those programs are all funded through Comcast. So we want to hear from people, all of you, about what needs you have, what technology needs you have, and why technology is important for you today. Because 20 years ago, 40 years ago, it wasn't as important, but it's super important now. So if you participate and help us answer those questions, what's important to you about technology? And you also help us answer the question, what was the other question? I just said them both. Anyway, there are only 2 questions. You can be entered to win a $250 gift card that we will give away today. So that means one of you 5 people that I'm looking at right now who is not hired by an organization or city government can walk home with $250. So all you have to do is come find Emma, who is waving right now, or me. We will take notes for you. We will put them up on the board. And if you say something like, hey, technology is really important to me because I really connect with my family on Facebook, and somebody else says the same thing, we're going to put little dots next to those. So we're going to find out how many people care about the same things. And we're going to be doing this all around the city. So you're our first stop. So you can come over to the table. If you have questions, we want to hear from you. Hopefully this is the most I will be talking today. Okay. And I don't know who's next.
Awesome. Thank you, Seattle IT, for coming out today and for, hearing about people's input. It's so important to hear. And so next we will get started, and I want to do a little intro with Sam really quickly. So Sam Stones is a SHIBA program lead. So Sam Stones is a statewide health insurance benefit advisor program lead at Solid Ground. Solid Ground works in partnership with the Washington State Office of Insurance Commissioner, OIC, to run the SHIBA program. SHIBA is a volunteer program that provides free, unbiased help to all Washington State residents on understanding their Medicare options and rights. Sam holds a bachelor's in sociology with a focus on health disparities in the United States. His background is in community building and volunteer engagement. He is motivated by the impact that SHIBA program has on helping community members feel empowered in their healthcare choices and breaking down barriers navigating the complex system of Medicare. So without further ado, we're gonna let Sam take it over. And yeah, thank you so much for being here, Sam.
Thank you. I'm Sam Stone, the SHIBA program lead. My presentation today is going to be talking about Medicare open enrollment, everyone's favorite topic. I'll try and keep it as easy as I can. Medicare is a very complex system, so if you're confused, you are not alone. That's why our program exists. If you are just getting started in Medicare, this isn't the presentation for you. I just want to make that clear. This presentation is for people already in Medicare who are looking to make changes to their plan for 2025 for Medicare open enrollment, which runs from now until December 7th. If you are not quite yet in Medicare, but will be enrolling soon, we also do a welcome to Medicare presentation that kind of covers everything about Medicare and how to enroll. So look out for that. That's relevant to you. Just do the next slide. First, I'll talk about Solid Ground and how SHIBA is connected to us. So I work for Solid Ground. We're a nonprofit in North Seattle in the Wallingford area. We just celebrated our 50th anniversary this year, actually. Thank you. We believe that poverty is solvable. We do this by meeting basic needs and nurturing success and spreading change. So we have a lot of programs, not just SHIBA. We have housing assistance programs. We have tenant help. We run an educational farm down in South Park. It has the community food education, program, which sounds like you guys, had or will have. We also have a legal benefit team and just a couple more, programs. So if you're interested in more on what we have, you can go to our website at www.summit-ground.org. And we work in partnership with the Office of Insurance Commissioner to run the SHIBA program for King County. We're one of two sponsors for King County. The other one is CISC, the Chinese Information Services Center. And they have volunteers that speak Chinese and Vietnamese. So if you need help in those languages, I would highly suggest you reach out to them. If you go to the, oh, no, that's the right one. And so SHIBA program, the statewide health insurance benefits advisors program, is a volunteer program that's been around for 45 years. They celebrated their 45th anniversary this year. It's part of the Washington State Office of Insurance Commissioner. And we are in it partners with local organizations to run it by county. So every county in Washington has their own SHIBA program. And then it's also a national program. So most states, almost every state has a similar program under the acronym SHIP. It's a lot of acronyms in this. Our mission is to provide free, unbiased, and confidential help to all Washington residents with Medicare. And the biggest takeaway for us is that we are free and we're unbiased. We're not trying to sell you anything. We're not insurance brokers or partnered with them. The whole point is that our information we're giving to you is free and unbiased. We are trained in Medicare. The Office of Insurance Commissioner trains our volunteers on all our updates, and so we know what we're talking about. And I'll just go if you just go to the next slide, I'll just kind of reiterate or kind of remind everyone what Medicare is before I start, just so we all have a understanding. So Medicare is a health insurance for people ages 65 and older. Or under 65, either receiving SSDI or social disability benefits for at least 2 years, or some people with specific diseases. You do need to be a citizen or a legal permanent resident for at least 5 continuous years to be eligible. And it is administered by CMS, Centers for Medicare and Medicaid Services. But your initial enrollment is actually through Social Security, through SSA. Unless you work for the Railroad Retirement Board, in which case it's automatic enrollment. Medicare generally pays 80% of Medicare necessary charges if services are provided by a Medicare approved provider, and you are responsible for the remaining 20%. And so Medicare open enrollment it runs from October 15th through December 7th. It is the one time of year when most people on Medicare can change their plan. Okay. So one time a year that most people on Medicare can change their plan for the next year. So for 2025. If you're on original Medicare, if you have a Medicare Advantage plan or a Medicare Part D prescription plan, you can change any of those during this time, and the coverage starts January 1st of 2025. This might be your only time to change for coverage 2025, so it's very important that you take a look at your plan and if it's changing, because plans do change every year. What you have covered now might not be covered next year, even if you're still in the same plan. Just some general recommendations. If you go to the next slide. This is just advice in general at all times. Anytime you're talking to insurance agents or medical providers, including your doctor, just keep a notebook and copies of any paperwork you receive. If you have any conversations, document any names, like who you talked to, the date, and if their contact information, if you can get one. Especially if you're talking on the phone, they record all of those phone calls. So if you mark down the day and time and who you talked to, if you have an issue, you need to go back, they can listen to that again and see what you said. And also, as always, be aware of fraud. Medicare fraud is at an all-time high, especially during open enrollment. Medicare will not call you unless you ask them to. And so if someone calls saying they're Medicare, they're looking to get your Medicare number, do not give it to them. Treat it like a social security number or a credit card number. Just keep it safe from people. And so, like I said, coverage change every year, plans change, costs change, and your own needs change. We do recommend that you review your coverage every year during this time, even if you're happy with your current coverage, because again, it might not be the same next year. If you already have a Part D or a Medicare Advantage plan, your plan would have sent you a letter called an annual notice of change by late September. And this letter will tell you if there's any changes to your prescription drug plan or coverage that's happening next year. Or if your current plan doesn't cover drugs that you need anymore, you can compare plans to find the plans that might. There are a lot of plans that are dropping. A lot of Medicare Advantage plans are no longer being offered for next year. And so that will be your time to change into a new one. If you don't do anything at this time, you'll either remain in the same plan unless that plan is no longer being offered, in which case they'll choose a plan for you, which often isn't the best case because they don't know you need. You do. And so I guess kind of mark your calendar for that important dates. We're already in it. Starting October 15th. Every Medicare household would have received a Medicare and You 2025 book in the mail. I did bring some in the back if you want to grab one of those. This covers all the changes and plans that are available for 2025, Medicare Advantage plans that are available. And then your new coverage it will start on January 1st. And you have until December 7th to change your plan. So during Medicare open enrollment, you can join, switch, or drop a Medicare Part D plan, that is prescription drug plan, a Medicare Advantage or Part C plan, or you can switch back to original Medicare. So if you're on a Medicare Advantage plan, you can switch back to original Medicare and get a Part D plan, or vice versa. If you're on original Medicare, you can switch to a Medicare Advantage plan during this time. And then your changes will take effect January 1st. And I will talk a little bit about the 4 parts of Medicare, just to remind everyone what it covers. So there are 4 parts of Medicare. There's Part A, which is hospital insurance. Part A is free if you have 40 credits of work that you paid Medicare taxes towards. So that's about 10 years of work. People get settled. Okay, I'll start then. Thank you, welcome. So Part A is hospital insurance. Again, this is free if you have had at least 10 years of work history credits. If you don't yet have that, there is a premium for that every month. Part B is medical insurance, and the standard monthly premium for this is going up. It's projected to be about $185 a month, and it can be higher depending on your income. But if your income is low, you might, there are programs that can help with this cost, which I'll talk about a little bit later. Part C is Medicare Advantage. So these act are similar to HMOs, PPOs, and Part B includes Part A and Part C includes Part A and B, and it usually also includes Part D prescription drug coverage. And then there is Part D, prescription drug coverage, and most people pay a monthly premium for this as well. There is a program that can help for this cost. We'll talk about in a little bit. So this graphic, if you could just go to the next slide. So this graphic kind of tries to help show the different paths that you can take for Medicare. So the one on the left-hand side is original Medicare, that's Part A, Part B. Optional is a Part D prescription drug plan, which we highly encourage everyone to get. It's just good to have. And then on the right-hand side, there's the other way of getting Medicare, which is a Medicare Advantage plan, and it kind of bundles the Part A and B, and then usually a Part D prescription drug plan together. When you choose original Medicare, you use your red, white, and blue Medicare card when you see Medicare providers. And when you choose Medicare Advantage, your doctors will bill your Medicare Advantage insurance plan, and you use your MA insurance plan card. If you do go into a Medicare Advantage plan, or if you have one, just make sure that the doctors you want to see accept that specific plan. You can call their office and you can check. But they do need to accept your plan for coverage to be covered. And so for enrollment requirements, to enroll in Part D, you have to either have Part A or Part B or both. For a Medicare Advantage plan, you need both Part A and Part B. To enroll in a Part D or Medicare Advantage plan, you need to live in the plan service area. You are most likely going to be required to use that plan's provider network. And you cannot live outside the United States. And you have to actively enroll into that plan. So usually by completing an application or enrolling with that plan directly. Most Medicare Advantage plans have a network of providers and hospitals. And so again, just make sure that the doctors that you see and the hospitals that you want to go to are accepted by that plan. Or you might need to find a different plan that will accept those that you want to see. And so how to choose a plan? There is a pretty helpful tool on the Medicare.gov website called Plan Finder. You can go to that at the website there, and there's a slide in a little bit that kind of has a better view of how to access it. So there's a button that you can hit that says compare plans. You can compare up to like 6 plans, I think, and you can enter in all your own drugs, the pharmacies that you want to go to, and you can compare the costs and coverage yourself that way. It's very helpful if you make an account through Medicare.gov. Once you make an account, all your prescriptions can be saved, all your specifications that you want can be saved. We recommend doing that because right now it's very often that Plan Finder will crash. A lot of people are using it, and it's pretty demoralizing once you've entered in all your prescription drugs to have it crash and you have to start over again. So we do recommend that you make the account, but you can just use it as an anonymous user. We do recommend that you don't just look at premiums and deductibles, review all costs. For Medicare Advantage plans, usually if the monthly premium is lower, the other costs like co-pays, co-insurance, or deductibles are going to be higher. So just make sure to look at all the costs, not just a few. And then the next slide, yeah, so this is kind of a picture of what it looks like, the website, and that top left corner is the Find Plans button. If you click that, that will take you to the Plan Finder. You enter your zip code, and then it kind of goes through all the local pharmacies and plans that are available. If you need more information on how to enroll, we do recommend calling 1-800-Medicare right now. Over giving us a call. Shiva, of course, we can help you. Our volunteers are very busy right now. We've had the largest amount of calls we've ever had this year of people calling us. We're a pretty small volunteer group, and we have over 200 calls to get back to. So we are giving people about a 2-week wait on our end to give you a call back. Medicare, they're open 24 hours, so you can call anytime of night or day, other than major holidays like Thanksgiving. And they can help you compare plans, they can help you enroll into a plan. So if you need immediate assistance, we recommend that you give Medicare a call first. If you're willing to wait a little bit, you can give us a call and we'll give you a call back within 2 weeks from now. Before you enroll into a plan, we do recommend that you call the plan directly as well and speak to a representative, just to make sure that everything you saw on Plan Finder is true about the plan. And then also just to kind of get a sense of what the customer service is like. So if you have to call them when you do the plan, if it's an enjoyable experience, if you enjoyed talking to the person, you know, just make sure that you know what you're getting yourself into before you enroll. And once you've chosen the plan that you want, we do recommend, you know, either enrolling online through Plan Finder, because through that tool you can enroll through that right away, or by calling 100 Medicare and enrolling through them. You can call the plan and enroll directly through them, but it does take much longer. If anyone has seen the really long text of terms and agreements that usually people will scroll through or just click through, if you talk to a representative with the plan, they're going to insist on reading that to you. So it can take a very long time if you call the plan to enroll in them. But that's also okay. We also want everyone to make a note to make any copies or paperworks of any paperwork or print any online confirmations of enrollment. Just in case something happens, you have proof that you did enroll. So if you get help enrolling, you know, note the date, the time, name, and phone number of the person you talk to. Right now, as they input data into Plan Finder, it can change between now and the end of open enrollment. And so if you know, you enroll into a plan now, and then by the time open enrollment ends, you find out that something pretty major changed about that plan, you want to have proof of what you enrolled into is told you what this specific thing, so you can show Medicare and they'll give you a special enrollment period to change if you need to. And then if you switch from a Medicare Advantage plan or a Part D plan to another one, you don't need to drop that plan yourself. It will automatically switch January 1st to your new plan. If you do switch plans more than once during open enrollment, you make a plan today, and then next week you decide you want a different plan, it will switch to your last change automatically. If you do switch twice, we do again recommend that you keep any documentation that you did that, just in case there's a glitch in the system or an error, you can kind of show Medicare proof that you did it. And then this slide, it kind of just shows you a visual aid, you know, what you can do. So you can change from one standalone Part D plan to another. You can change from a standalone Part D plan into a Medicare Advantage plan, taking it out of original Medicare. You can switch from one Medicare Advantage plan to another, or a Medicare Advantage plan to a standalone Part D plan, which will then take you out of Medicare Advantage and back to original Medicare. So you can kind of remember from the beginning, there's the two paths of Medicare. There's original Medicare on the left-hand side. There's Medicare Advantage on the right-hand side. They're both Medicare. There's two different ways to get it, and they act differently. There are some major changes coming up for Part D prescription drugs for 2025. The first major change is the donut hole is going away. This was a time period where you would pay more for prescription drugs if you didn't meet a certain deductible amount, but that's going away. So it's a good thing. There's also a $2,000 out-of-pocket cap on covered medications. And so then most you'll pay on covered prescription drugs in a year will be $2,000. But they must be covered by your plan, so they have to be covered prescription drugs. And then there is a new Medicare payment prescription program that's available. So this program will let you spread out the costs of your prescription drugs throughout the year instead of, paying the total upfront at the very beginning. So if you're interested in that, you can, ask your pharmacist, and they should know a little bit more about how to enroll you into that, or how it's set up for you. And so there's some programs can help paying for Medicare if you are low income. There's kind of two different major plans. The first one is called Extra Help. It helps with Part D prescription drug costs. This is a federal program and it's managed through Social Security. And so your enrollment would be through socialsecurity.gov. And then there's the Medicare Savings Program, or MSP for short. And this helps with Medicare Parts A and B costs. And this is managed by the state, so it is through DSHS is where you would apply for these programs. And the first program is Medicare Savings Program. The rates are listed up here. So if you make roughly $1,700, $1,752 as a single person or less a month, you might qualify. If you're a couple, it's $2,371. And these programs will help pay Part B premiums. You'll never pay a late enrollment penalty while enrolled into this program. So if you're enrolled into Part B, you have a penalty for that, your penalty will go away. You'll automatically be deemed eligible for Extra Help. So if you enroll into this program, they'll automatically enroll you into that second program I talked about that covers costs for Part D prescription drugs. And again, the eligibility for this is through DSHS. There's no asset test for this, so it's just income. They don't look at any of your other resources, which is different for Extra Help. Help does look at assets. Again, Extra Help is through Social Security. This helps cover the costs for Part D premiums, deductible, and co-pays. And so if you make, as a single person, around $1,900 a month, or $2,575 as a couple, then you have less than $17,220 in resources or assets. As a single person, or $34,360 as a couple. Consider applying for this program. And if you make close to this amount, maybe you're a little bit over, try applying anyway, just to see. Because they may just let you in. One benefit I guess I'll highlight on this as well, in the Extra Help program, you can join or switch plans, like prescription drug plans at any point of during the year. So if you're in Extra Help, you're not bound by open enrollment time to make a plan. You can switch plans once every quarter. So that was my spiel. Hopefully that wasn't too confusing. I can take questions from the audience. I guess I'll say a couple more things. Again, this is very overwhelming to a lot of people. So if you do need help, you can contact Medicare. The staff there can help you. Open 24 hours. You can utilize the Medicare.gov plan finder tool. It is very helpful to comparing plans for you. And then you can also always reach out to us at Sheba. There's a 2-week wait time. I do have another slide with my contact details too. And then if you want to reach out to us about any other solid grant program, solid grants number is up there as well. I can take questions. I do ask that they are more general questions, not personal health questions to your own situation. Just so no one's sharing personal information to the public.
And we have some questions. One of the questions we got so far is, So with Sheba, they don't help with enrolling folks, correct? Like in an insurance plan after original Medicare? Okay, so they don't. And so, is Plan Finder are you able to call Plan Finder? So Plan Finder is only an online service. Do we know what languages Plan Finder is available in?
Medicare has to provide. Languages so Medicare has to provide accommodation to all languages, so when you call, there will be an interpretation service. If you can't use the Medicare.gov Plan Finder tool, if you call Medicare, they can run it for you.
And then could you walk us through what it might look like once you find a plan on Plan Finder? What does the process look like after that?
So the process, if you find a plan that you want to enroll in, there's just an enrollment button that you can click if you want to do that. Again, we do recommend that you call the plan first just to double check everything is correct that you see before you do that. But once you're done talking to them, you can just enroll directly online.
And when we enroll, we're talking about enrolling with a separate insurance company, right? This isn't a government program that we're enrolling in on Plan Finder.
Yeah, Medicare Advantage plans are private or sold by private companies. Prescription drug plans are also sold by private companies. And so this isn't managed through them at all. It's just a tool to help you enroll into these plans.
And then with Sheba, what languages do you all provide help in?
And so for us, our volunteers only speak English at this time, but we are able to use an interpretation service. So if you have a language that you want to speak in, we can use an interpretation service to help. And then CISC, the other sponsor I mentioned, their volunteers do speak Vietnamese and Chinese. And so if you want to speak those languages, I would recommend calling them, and a volunteer speaks those
Program presently I'm in HMO, it's medical complete, Medicare complete. And here it is so many Humana, so many choice, and Humana gold, and what's the difference there?
Sam, so she has the 2025 Medicare Advantage plans for King County, and she's talking about Humana as a company and how they have, it looks like almost a full sheet of plans. Can you explain, like, maybe just broadly what the differences are for each of those?
Yeah, a lot of companies have different Medicare Advantage options, and essentially the coverage it just depends. It differs on the prescriptions it covers, the extra benefits, because Medicare Advantage plans will have extra benefit coverage. And so depending in like the doctors that cover that specific plan, those are all unique to the plan. I definitely would recommend, again, using the Plan Finder tool to kind of compare the plans to see the differences, to make sure that your drugs are covered in that specific Humana plan. Or you can also call Medicare, they should be able to help you compare.
Yeah, and does that answer that question for you? Yeah. Yeah. No, there's definitely, each company offers quite a range of plans, and so definitely using Pathfinder or calling or Medicare and asking them is a good idea if you feel like your plan currently isn't fitting you or maybe it's ending, I think. There are definitely lots of plans on there. I'm gonna move to the next question real quick.
Could you tell, you mentioned changing from a Medicare Advantage plan back to Medicare? And it sounded like all you had to do was sign up for Part D and you would automatically be changed back?
That's correct, yeah.
Okay, because when I've looked it up online, there's things like, oh, it's very difficult to change back to regular Medicare if you do an Advantage plan, then it's real hard to change back to Medicare.
And, the question.
Did you get a question?
I heard it.
Okay.
Or, can you repeat it first?
The question, I'll try and repeat it. You've been told that it's difficult to change back from a Medicare Advantage back to original Medicare. Is it true that you just need to enroll into a prescription drug plan to get back into original Medicare? That is true. Yeah, you're only allowed legally to have one prescription drug plan. And so whichever one you enroll into during this time, basically will unenroll you in your old plan. If you are going from Medicare Advantage back to original Medicare, with a prescription drug plan, just be aware that, you know, Medicare covers 80% of your covered costs. You are responsible for that 20%. And so there could be a large amount of fees uncovered when you go back to original Medicare. But no, it's nothing more than that. You just picking a prescription drug plan and that will automatically take you out of Medicare Advantage. Yeah.
Any other questions in the audience? Any questions?
Now's your time. Yes. I know some people arrived after the presentation started. Is there any questions that they have about their Medicare plan? This is the person to ask, right? So I know some of you arrived towards the end. I can wait. There's no wrong question. Okay, he'll wrap up, and then even afterwards, if you have questions, I'm sure he'll be around for a little bit, so if you have some additional questions. Does that work?
Yeah, that works.
And Sam, for a final question, I always like to add, is there anything you'd like to tell the audience or reiterate from the presentation to wrap us up?
Yeah, just make sure to check your coverage, that your current coverage that you're in. Make sure that it still covers your needs, because again, your plans do change every year. Your current plan probably won't be the same next year as it is this year. And make sure that you have the coverage that's gonna work for you in 2025. Thank you.
All right, I just want to thank Sam, if we could all give her a round of applause. Thank you to Shiva and all the work that you do for our community, and Medicare is a very complicated system, so we thank you for that. And Sam will be around for a little bit to answer any other questions you have. Please stop by the IT table and talk with these lovely folks and get entered for a $250 gift card. And then we will also, yeah, if there's anything else.
Don't forget, it's voting season. So as you exit, there's Demi, who works for Seattle Housing Authority. Her whole role is now, mission is to get as many people in communities registered to vote. There's chocolate, so if you need a little sweetie after you ate your empanada, come on and do it. If you have children 16 and older, they can register to vote and they'll automatically be kicked in at 18. If you have a conviction, it doesn't matter in the state of Washington if you're not currently in jail. Please tell everybody to register to vote. You can actually register to vote, I think up until the day of the election. You can register and vote at the election places. So I don't know all the details. I'm not an expert, but if you have any questions, you can talk to Demi out there, get a button, encourage your neighbors to get registered to vote, because only we can make change. All right.
And thank you to SHA and Neighborhood House for hosting us today. And with that, we will